Hello, everyone. This is Melinda Bikini with the Cholangiocarcinoma Foundation. Thank you for joining us tonight. We are just about to get started here. I am going to turn over the controls to Stacy from Ciitizen so she can present their information on their platform. And hopefully at the end, we can take some questions through the chat board, through the message. So if you have any questions, just go ahead and log them in there. And between Rick and I, we will make sure your questions get answered. We will be recording this in case anyone wants to view it later, or for those who couldn't join us, they can view it later. So right now I'm going to introduce you to Stacy with Ciitizen, and I'll let her do a better introduction of herself. And thank you for joining us.
Hi there, everybody. My name is Stacy Tignano, and as Melinda mentioned, I am with Ciitizen. I'm actually the Director of Advocacy and Engagement with Ciitizen, and if you weren't already aware, we announced a partnership with Cholangiocarcinoma Foundation on the 12th of August. So I'm delighted to chat with you today. I don't know if some of you maybe were on one of the original webinars that we did about a month ago, but we're going to go through a bunch of things today. Ciitizen is a company that believes that individuals need to have agency and stewardship over their own health data. And one of the reasons we signed a partnership with Cholangiocarcinoma Foundation is because you guys believe the same. So in an hour, we're going to go through really quickly what health data is when we talk about it as Ciitizen and when we talk about it as part of HIPAA. We're going to talk about the value of that health data, which most of you probably already know. We're going to talk about your rights, and these are the rights of any individual who is treated in the US. And then we're going to talk about the partnership and what it means for you and how you can participate. And then, as Melinda mentioned at the end of the presentation, if there are any questions, happy to answer them. And then if you think of any questions after the fact, again, happy to answer them. So Ciitizen was founded by the man on the very far right of your screen. His name is Anil Sethi. And Anil is smiling there with his baby sister, Tanya Sethi, who was diagnosed with de novo metastatic breast cancer at the age of 46. Anil had a digital health startup. That digital health startup was sold to Apple. And then Anil focused his efforts on going around the world really with Tanya to try and find her the absolute best treatment to give her the best chance at beating cancer. Unfortunately, cancer killed Tanya in September of 2017, and Anil made a promise to her that he would take cancer out. And the only way he knows how to do that, his words, not mine, was to start a company. So he founded Ciitizen. His second hire was the woman in the middle. Her name is Devin McGraw, and she was formerly the Deputy Director of Health Privacy at HHS. And so when you hear HIPAA and when you know that there's guidance associated with HIPAA, Devin is actually the individual who wrote that guidance. And then on the far left, that's my mom with the bald head, and she, this is back in 2013, she was diagnosed in January of 2013 with breast cancer. I took a leave from my job in California, flew back and forth from California to Texas to get her through surgeries, to get her through treatment. And about 2 weeks after this picture was taken, that's me with the long hair, I had my very first mammogram and I was diagnosed with breast cancer. So those are just a few stories from those of us who work at Ciitizen. So it is much more than just a job for us. This is absolutely part of our passion and our mission to educate people and to help to empower them with their own health data. So when we think of health data, a lot of individuals go directly to the medical record, and the medical record is a great place to start. It is protected under HIPAA. It is not all of the health data that you are entitled to access as part of the Health Information Portability and Accountability Act. So your medical records, your emergency visit records, any of your imaging, your lab results, surgical results, essentially anything that is used to make decisions about your care is health data. And all of that health data is available to you under HIPAA and the patient right of access. The value of your health data, and again, if you're on this call, you probably already know this, but with your health data, you can actually improve your own care coordination. You can help get a second opinion in much faster time. You can help to share that information with your family caregivers or other physicians. You can submit to clinical trial matching services and virtual tumor board services. And then, and part of what we're going to talk about today is you can choose to share that information with registries to accelerate research. So there's a handful of things to know. Sorry, as I move my little screen thing around here. Oops. No. Your data is available to you, and your right of access under HIPAA entitles you to all of your data. So again, not just your medical record, all of the designated record set. You are entitled to receive that in your preferred format. So if you would like to receive that information via email, if you would like to receive that information in a big stack of paper, if you would like to receive that information on a disk, you are entitled to receive it in the way that you request. You're entitled to all that information within 30 days from the date that the request is received. There should be limited fees for you to access your health data. So if you've ever been told that it's going to be $25 to request your data, and then it's going to be $1 a page after that, that organization, that institution is actually out of compliance with HIPAA and the patient right of access. And finally, you're entitled to share that information with a third party. So if you give somebody access to your health record, an institution can send it directly to them. And that's fundamentally what we're going to talk about when we talk about Ciitizen and the Ciitizen platform. Let's see. So this is kind of what we talked a little bit about before, but the designated record set as it pertains to your health data is anything in your record that is used to make decisions about your care. So some details around the form or format. As long as the health institution can readily produce it in that form or format, meaning that if you wanted your information sent electronically and that institution for some reason didn't have a computer, then they could say, you know what, we actually can't get it to you electronically. I don't think that's the case with any organization, so you hopefully don't ever hear that. You have a right to receive it by unsecured email. So I don't know if any of you have ever received an encrypted email. They can be a pain in the butt sometimes to open. They have passwords and it's a little bit challenging, or you have to log into a special portal to get it. As long as you say that you would like it via an unsecured email, and as long as you acknowledge any risk inherent with that, they are required by law to share it with you that way. You can't force any organization to accept a format that might cause them security risks. And the example that we use is a thumb drive. If you were to bring a thumb drive into the office and say, please just put all my records on this, the organization can actually decline because they don't know if you might be, there might be a virus on that thumb drive. So pretty much without exception, you have a right to get your data in the way that you'd like to have it. The institution must give you access within 30 days of your request, and there's very limited exceptions to that. They are permitted a 30-day extension, but they need to be very upfront about why that is. Limited fees, we talked about that a little bit earlier. Entities are strongly encouraged now to provide free copies of health data to patients, and if they're sending it electronically, they can't charge you per page, because obviously the time it takes to put that into an email is probably doesn't have a cost associated with it. And finally, the right of access under HIPAA to a third party. You can have this information sent to another healthcare provider, to a family member, to a health record platform, to a research program, and then every provision that we just talked about actually applies when you have it sent to a third party. So the timing, the fees, the form, and the format. Family members have rights as well, so you can, and I don't know how many of you have signed over a kind of a HIPAA disclosure, right of access to family members, spouses, adult children, but if they are empowered to make medical decisions for you and our personal representatives, they can exercise this same right of access. From a hospital and doctor standpoint, doctors and healthcare facilities are permitted to share information relevant to the care of an individual, but it's permitted, it is not required. And then finally, can people say no? Can health institutions say no? Very, very limited exceptions to being able to say no. If the information might cause you serious physical harm, and mind you, that's not like I can't release your records because that would be scary for you. That's not considered serious physical harm. Information collected as part of a research study. So I don't know how many of you have been part of a clinical trial, but if you've been part of a clinical trial, you know that that information is usually kept secure until that trial and that study is published. And so that information is not, does not fall under the HIPAA right of access. The covered entity may require you to write a written request, but that written request can come through email. So if you're ever told that you need to come into the office or you need to mail in a request, that facility is actually out of compliance with your with the HIPAA privacy law and the right of access. They cannot require you to give a reason for wanting your records. They can ask, but you don't have to tell them, and they can't make a decision to either share them with you or not share them with you based on that reason. They cannot say no because you have not paid your healthcare bill. So those two things are very, very separate. You have a right to access your health information regardless of whether or not you owe that facility money. And then again, concerns that you might not understand the information, that you might be upset by that information, does not apply. That's not physical harm, and you are still entitled to access to your health information. So now let's get to the partnership. Why are we excited to work with the Cholangiocarcinoma Foundation? For a handful of reasons. I mentioned earlier on the call that I am a breast cancer thriver. There are a lot of organizations that are trying to do research, that are raising money, that are trying to find out why somebody gets diagnosed, you know, with our very first mammogram. We don't have that same structure and infrastructure in some of the rare disease communities. So cholangiocarcinoma is an overlooked and underserved population, as again, I'm sure many of you are aware. The big important piece of that is large data sets move research. In the breast cancer space specifically, we do have a cohort. We have a male breast cancer cohort, and they are almost like their own rare disease. They don't have the support of a large cohort to try to get things done, and so there are a couple of very small advocacy groups that are trying to change that. We would like to help you guys build the large data set to move the research. We know, and we're super excited about the fact that you already have a registry, a rather large registry, and what we'd like to do is help add to the robustness of that registry with the Ciitizen platform and with enabling you to access all of your health data. So registries have challenges, and as many of you know, most registries are built on survey data. There are a lot of challenges when you go to a population and you say, please fill in all the information about your cancer. First and foremost, there is the accuracy piece. Many of us know exactly what we were diagnosed with, what we were treated with, how we responded to that. That doesn't mean that research looks at that data and trusts it. If they don't have data provenance, if they can't tell where that diagnosis came from or where that pathology came from, it's interesting, it might show patterns, but it's nothing that they can necessarily act on, and it's lacking what they consider clinical validity. The other piece is really around the completeness and even sometimes the accuracy. And again, I know in my own community, I talk with people who maybe had a breast cancer diagnosis 10, 15, 20 years ago and have now metastasized. We know that that is actually a breast cancer that is now growing in a different part of that body, perhaps the lung, perhaps the brain. But frequently when people fill out their registry information, they say that they have lung cancer or they say that they have brain cancer. And so the accuracy and the validity of that registry then is very, very challenged. Okay, I have a bunch of like crazy little control panel things. So let me see if I can move those things out of the way. Okay. Hopefully, Melinda, I can still hear you. Can you see your profile?
Yes, I can.
Okay, perfect. So I'm sharing with you, with Melinda's permission, the cancer summary that is created as part of the citizen experience. So again, we went through the health data access, the value of the health data, and what the Citizen platform is designed to do is to ease the friction for individuals to request their data, all of it. So with the Citizen platform, you log in, you create your profile, and then you have the ability to either upload existing health records or to request health records. You can request your health records from any institution that you've been seen at. That includes labs, that includes diagnostic testing companies, that includes imaging facilities. All of that data will be brought into your Citizen profile. I will go through my profile live in a minute so you can kind of see what that looks like. But the reality is, especially for people who have been dealing with disease for a long time, who have been on a lot of different treatment regimens, that's so expansive and really hard to dig through. So from a Citizen perspective, we've created a cancer summary. So we dig through that data and present the 19 fields that are most interesting if you were to use this data to get a second opinion, to try to get into a clinical trial. We are working with Cholangiocarcinoma Foundation to make sure that it is as robust as you need it in that particular disease space. So we'll continue to grow that. I'm not going to go through the detail here. I'll do it in my own platform. Let's see if I can magically. Okay. Can everybody, or Melinda, can you see my health profile now?
Yes, yours is up.
Perfect. So what I'm showing you now, and again, I'll walk through the process of creating a profile as well, but I've created mine. I requested my health records. They were brought into the system, and this is what it looks like for me. So if I go to this top document here, and I look over here, I can actually get a little bit of a preview. This is my Ambry genetics testing. So when I was diagnosed, I went through some genetic testing. That was one of the facilities I requested records from. Now here's an image of that. The next file is super interesting. It is a record of from Kaiser. I can preview it by pulling it up, and you can hopefully see that this is page 1 of 2,446 pages. This is a lot of information, would be a lot of information for me to dig through, a lot of information for me to paginate through. So rather than doing that, let me close that out, I can actually download that file. So if I download the file, now I have it on my computer. I can share it, I can store it, I can do whatever I need to do. And there it is. So now I can dig through all 2,400 pages if that's exciting to me. When you get down here, this is actually kind of interesting. These are imaging studies. They are presented in imaging format, my colonoscopy, if anybody wants to see that. It's very, very exciting. Here's one. This is the needle localization from my original diagnosis, and this was the original biopsy. So this is before they actually knew that I had cancer. So you can go through this in the study format. So this is a DICOM viewer. For those of you who are familiar with imaging, that's what the studies come in as. And so we allow you to kind of go through it. Some of these can get really, really big. And so when we request the data, what happens is the data will come in electronically to Ciitizen, but then usually imaging records come in via disks. And so we upload them for you and put them in this particular format. So you can see there's 18 imaging studies, there's 2 documents. One of those documents is almost 2,500 pages long. So it's much, much easier for me to just go to my cancer summary. With my cancer summary, I can look at my diagnosis. I have an adverse reaction here to a drug that I was on. And then I have my primary tumor location. So I actually had a few different locations. And if you look at the far right of the screen, so in the middle, I can go to each one of these elements. But on the far right, this is the place where it's pulled from. So this is the data provenance that we were talking about. So when the system says, hey, this is really interesting and it needs to go into the cancer summary, it also grabs where that information came from. And this is what makes the cancer summary card or cancer summary view so valuable when we start to talk about research and when we start to talk about registries. You can continue to go through here and start to again, it's weird being on a call where nobody can talk because I don't know if you guys have questions or not, but you can preview these documents, you can download these documents. And then here is, this is the care team piece. So right now, again, I mentioned you can download the information and you can share it however you want, but what we're hoping to do, again, is to remove friction from this process. And so you can add a care team member. So this could be another physician, this could be a family member. I'm going to add a care team member and I get to choose whether I want to share my entire profile with them, just my cancer summary view, or just a genomic report. So I'm going to go ahead and share everything. And then I can choose whether I want to share that for 30 days, for 1 year, or until I manually stop sharing. And now I add that individual by email. So I'm just adding myself at a different email address, confirming that I'm going to share my entire profile with them, and I confirm an invite. If at any time I want to go back and I want to add additional health records, I just go back to health records and I can add something here. So I'm going to walk everybody through that process, and I'm going to do it through the Citizen and Cholangiocarcinoma page. Melinda, just want to check in and make sure that this is sharing the way it's supposed to.
Yes, it sure is.
Perfect.
And I'm just going to interject real quick too, Stacy, to let the audience know if they have questions to please post them in the chat box.
Awesome, thank you. So this is the page that is just for individuals that are part of the Cholangiocarcinoma Foundation community. And it is designed so hopefully you guys will get all of your questions answered during this webinar. But if individuals don't have time to come to the webinar or join after the fact, hopefully there's enough information on here to help them understand why we're doing this and why it is so important. So the big blue buttons are the buttons that are probably most interesting. You click sign up, and now it is going to ask you for your email. So I'm going to create a test account here. It's going to ask me for my name. And then it's going to ask me to create a password, which I'm famous for not remembering the password and not getting it right, but it looks like I did it this time. Okay, so now I've created an account. So different than the account that I showed you earlier, this has nothing in it. There's a big button here that says get started now. And there's also this little button here that looks like a little smiley face. So this little button is a help. So if at any time you have any issues, any questions, there are real life people. This is Kelly, this is Jonathan, that are happy to answer your questions. There's also a little FAQ in here. So some of the more frequently asked questions we've put in here so you can go right away and get the answer that you need. So I'm closing out of this little guy and I'm going to go to get started now. And this is the consent process, reminding you of what we just learned, that under HIPAA you have a right to your health records and you have a right to have it sent to a third party. We would love to do that for you. We'd love to make that easy for you. And in order to do that, we need to have your consent. So you can request your records, or as I mentioned, you can upload your records. Even if you have already downloaded your records from some other location, usually through a portal, when you go through the request process, you actually get a much more complete set of health data than you get from a portal. So you will have the doctor's notes. We will be able to request imaging. We'll be able to request a bunch of things that you're not always able to get through a portal poll. So I'm going to go through the request my records section. You can put in your facility here. And oh, look, my facility didn't come up, probably because I spelled it wrong. So if my facility is not listed, I am going to just type it in. Oops, I typed it in the wrong place. And we'll make it in San Francisco. And we'll make it in California. And then I click continue. And it's going to ask me for my birthday. And let's get a date that's, and then it's going to ask me for my phone number. And then it's going to ask me if imaging was performed by this provider. So a lot of times when you go into a facility, everything is covered there. Sometimes you go to a facility and then you have to go to an alternate facility for imaging. If you don't know if that facility actually has your imaging records, you can just put unsure. If you know that you had an ultrasound, a PET, any other type of imaging scan, you just click yes. And then this is asking you if you want to have sensitive request record types in your request. And so what's considered sensitive record types as far as HIPAA is concerned is any of your mental health records, any of the status and test results related to HIV or AIDS status, any of your sexual health or reproductive care information, and any information in your health record on substance abuse. So we default to not retrieving this information. If you want that information retrieved, you can click any or all of these and then push continue. You need to have a photo of your official ID. This is typically a driver's license for individuals. If you don't have a driver's license, but you have a passport, this is absolutely acceptable. This is the hard part, and a lot of people are struggling with this. We need to get a good picture of it so that it is taken by the healthcare facilities. There's a couple ways to do this. You can take a picture of your ID and then upload it, or you can take a photo of your ID and then capture it here. Because I am sharing my screen and my video is being projected to you, I actually don't get a picture here, but what would happen is this would show a picture of me. I would hold my ID very steady up to it. I would click take a photo. It would give me the rendering of that, and then I click continue. And then you need to sign. So this is just confirming that you have made this freely, voluntarily, and without coercion. It's confirming that the information is accurate and complete to the best of your knowledge. And it is allowing Ciitizen to collect your personal health information or your PHI on your behalf. And you also understand that you can revoke this request at any time. It's going to give me an opportunity to review my information, and then I send the request. So now what's going to happen is, from a Ciitizen perspective, we are going to push that electronically out to the facilities that you requested information from. As we just talked about, facilities have up to 30 days to comply with the request. We've been at this for a little while now, and we've worked with many of the facilities. We just released a patient record scorecard that kind of shines a light on individuals, or not individuals, but institutions that are complying with HIPAA versus those that were struggling a little bit. So our return rate is actually getting much, much faster. You will be notified anytime a record comes into your platform. Typically in the cancer sphere, we are rarely just treated at one facility. So before you leave here, if you have an additional facility you want to request information from, you just click new request, and then you can go through that process again, but everything has already been saved. So you don't have to go back through your birthday, you don't have to go back through your phone number. You don't have to go back through this, but if it's different, definitely change your answer. Same with sensitive record types. This is actually a picture of my ID. Your signature is the same. Review it and then send the request. And you can do this for as many facilities that you've been treated at. And again, then we will go about getting that information from you. So when you go back to your profile, I've now switched back into my profile. Your documents will show up here. All of your imaging studies will show up down here. And then your cancer summary view will be a separate tab. Oops, I'm not quite sure what just happened. Okay, oops. All right, I am going back to the presentation. Do we have any questions at this point, Melinda?
Yes.
Rick, I think you've got them.
Yes, we do have a couple questions. Lorraine was saying, does HIPAA require agencies to respond to multiple requests for the same information to be sent at different times to different recipients?
Does HIPAA require the same request to, I'm not sure I understand the question, but you can make as...
Let me ask it again. That may have been the way I read it. Does HIPAA require agencies to respond to multiple requests for the same information to be sent at different times to different recipients?
Yes. So as the way that I understand this, the question as it's being asked is, as an individual, are you allowed to go to the same institution and say, I would like all of my information sent to this facility, to this facility, to this person, to this? Yes, it absolutely does. And you can do that as many times as you would like.
Okay. Can you shield any part of your record when you share with a particular facility?
Through the citizen profile, when I was going through the care team piece, you get to choose whether or not you want to share everything, whether or not you want to share just your cancer summary, or whether or not you want to just share your genomics report. This particular time, there's really not a way for us to break that down differently. But if you were sharing that outside of the Ciitizen platform and you wanted to download a particular piece of information and share it, you could definitely do that.
Okay. You discussed patient access to health documents. What about tissue samples? Can people request samples or resected tumors, biopsies, etc., to be sent to another institution or even to themselves?
You can, so on a personal note, I've actually done that. Unfortunately, biological tissue samples are not covered under HIPAA. So it's not the same rules and guidelines that we walked through before. You can request it, but they are not required to comply.
Okay. And then the last one, she would like you to explain how to submit one's photo for the ID again. She would like, can you explain again how you submit one's photo for your ID photo? Just take a picture of your ID.
Yeah. So what you're going to do, let me go through. This is the hospital that I just went to. Let's see. So this is, I'm going back to, can you see my screen? Am I back in the profile that I created?
Yes.
Okay. So this is the process that you're going to go through. So you're requesting your records. You're going to find your facility, or you're going to type in your facility. So for ease of use, we're just going to type hospital and see what comes up, or we're not. Okay. Oops. Let's try that again. Okay, so the first time you go through this process is the only time you need to worry about your ID. So once you request from a facility, you identify the facility, you're going to put in the information, your birthday, you're going to put in your phone number, And that phone number is so that we can contact you in case we have any questions. We're not sharing any of this information with anybody. It's just if we have particular questions. You're either asking for imaging to be part of this request, or you're saying no, imaging wasn't performed there, or you're saying I really don't know. If you say you really don't know, then we'll ask anyway and include it. You're going through your sensitive record types and whether or not you want those included in the request. And then when you get here to the photo of your, let me see if I stop sharing my webcam, if this will work. Okay. So when I share, when my computer video is occupied by something like a webinar or a Zoom, it takes it bandwidth from it that way, and it's focused on something else. What should happen right here is, okay, can you see me? Can you see my picture on the thing?
Yeah.
I don't know how it's working.
Yes.
Yes.
Okay, so this is the part where you would take your ID, you would hold it, you would let it fill up, you'd make sure it was all on there, and then you would click this take photo. So I don't actually have my ID, but let's pretend it was this. If I don't like that particular photo, if it's blurry, if it's not, if I cut off half of it, if it doesn't look good, I can just say cancel. And then I'm going to say take photo of ID, and okay, here we go. Whoop. Put it right there. And I'm going to take photo. The other thing I can do, let's cancel that one. If I cannot get a good image of my photo that way, you can take a picture like on your camera, on your phone, and then if you can upload that. And I don't actually have a picture. That would be a good thing for me to have, but we'll put a picture of my child on here. Okay, pretend that's a photo ID, and then we could choose that one. Does that make sense? Is that answering the question on how to do this?
Sorry, I was muted. Yes, I think that answers it.
Okay.
How is the information on the platform secured?
Okay, we use Amazon Web Services, and all the data is encrypted. We follow HIPAA guidelines, and so HIPAA, for those of you who aren't aware, it's not just about not sharing information, it's a whole protocol and a whole operational system inside a facility to make sure that people are never identified by their name, that birthdays aren't included, everybody gets a user code. So we're very, very careful to follow all of those guidelines. But Amazon Web Services and encrypted data is how the data is stored. Does that answer the question?
Yep, I think that, and that's all the questions everybody has for right now. I'm sure there'll be more as we continue.
Okay. So getting back to this partnership and getting back to kind of why we did this. We at Ciitizen absolutely want everybody to have their own health data, to do with it what you want to do with it, to use it for your own care coordination, just to have. I think, you know, from my perspective, as you kind of get through treatments, and maybe you're fortunate enough to be in a period where there is no evidence of disease, it's super important to have this information and to hang on to it. But the value in this partnership and the value in the Cholangiocarcinoma Foundation and Ciitizen working together is, our hope is that everybody who is part of Cholangiocarcinoma Foundation will get their Ciitizen profile, and then we'll share it back to Cholangiocarcinoma Foundation, to the registry. Because really the power in all of this is going to be making that registry even more robust than it already is. And that's why we want to open this up to all of the individuals here. Super important to note, if I didn't mention this 5 times already, I've failed. We don't share your data with anybody. And the way that I like to explain it is that there is no back door in Ciitizen, there's only a front door. You come in the front door, you say, I want to get all my health data. We use the front door to go get your health data, and then it's yours. We never de-identify and send stuff out the back end. We don't say, hey, we've got this information. Everything goes through you, and the consent processes are always, you know, through the individual. That said, our hope is that we do get everybody to join Ciitizen to create their profile, and then we can re-ask you to share that back with Cholangiocarcinoma Foundation to the registry. Does that make sense? I guess to Rick and Melinda, does that make sense?
Yes, it does make sense, and we just definitely want to reiterate that, yes, we're not going to take your information from Ciitizen. That is up to you to decide to share it. So that will totally be your choice. Like Stacy said, that's your information, and then it's your choice to share it back to the registry if you so desire.
So with that, I really want to go through the process of how to join the private beta. I walked you through that process. There is a link on the screen. That link I will send to everybody who registered. I will send it out. I know that link has probably already been sent out to all of Cholangiocarcinoma Foundation. You will see that link a lot. When you are ready, please click on that link. Please complete your profile information. Please either upload or ideally request data. Again, a lot of times the data that we have, that we've gotten from a facility, that we've gotten from our portal, it's not nearly as complete as the entire designated record set. You can create your profile. You can request your health data from any institution that you've had care at. So this includes imaging, this includes labs, this includes any genomics providers that you've used as part of your care. And then you'll receive notification as the records come into your Ciitizen account. So with that, are there any more questions? I think the hope is to kind of do this webinar on a regular basis, on a monthly basis. Our interface is changing very, very rapidly. We're constantly making improvements. So in addition to hopefully helping you get all of your health data, we would love to have your feedback on the process. If there's something that is confusing, if there's something that we could make easier, if there's something that we're doing well and you think we should definitely keep doing, please let us know. We also would love to offer, for those people who want it, what we're calling concierge onboarding. So if at any point you would like to schedule, 10 minutes, 15 minutes with somebody on our team to help you walk through that process, we are more than happy to do that. And some information about that will come out in the email after the webinar. In addition, we will send out the link to the webinar. So if there's something magical that you missed, you can go back and watch it again and again and again.
And it looks like there's one more question, but I think it's more of a question. Melinda, you can probably answer it about our registry. If Ciitizen gets their approval and then connects their data to the CCF registry, our registry then de-identifies that information for researchers. Is that correct?
Correct.
That's what I thought. Wanted to make sure.
Correct.
Question that someone had.
That is correct. I guess to a certain aspect, unless you want to put your information in. We're hoping to use our patient registry as a way to communicate with patients as well. So I think with the new platform on the registry, there will be an option for you to leave it de-identified or to be identified if you want to be further contacted in case like a clinical trial comes out and we can reach you that way. But I think further down the road, the foundation will go more into detail when we get the new patient registry platform up and running as well. But yes, any information that you want de-identified is always kept that way.
Great. That's it. No more questions over here.
Stacy, thank you so much. And like she said, we're probably going to continue to do this webinar over and over so that everyone can get access to it and understand it. This one will be recorded and posted for a brief time because, like she said, their platform is continually being upgraded and changed. So we'll record each webinar as we do it and post them. So feel free to share with others. And if you have any questions, you can reach out to me through the foundation or to Stacy through Ciitizen. Thank you so much, Stacy. We appreciate it very much.
Thank you. Have a great night.
You all have a great night. Thanks for joining.